Here at Baptist Healthcare, we have real legends among our team. We have ordinary people who inspire us with extraordinary actions. While driving to work, Kim Ard, a registered nurse at Baptist Hospital, saw a gentleman who had fallen off his bicycle and was struggling to stand. Kim went out of her way to check on him and realized he needed medical attention. She called for an ambulance and waited until the paramedics arrived. She placed his bicycle in her car and followed his ambulance to Baptist Hospital's emergency room. While in the ER, the man told Kim his cell phone battery was nearly dead. Kim went to the gift shop and bought him a new phone charger. While the patient was being cared for, Kim obtained his mom's phone number and called her to give her updates on her son. The ER care team determined that the man had a broken leg. The patient had no way to get back home since his mother was bedbound and unable to drive. Kim gave him a ride home. A week later, the man returned to the hospital to have surgery to heal his leg. Kim followed up with his progress and brought him snacks he could enjoy after surgery. As Moira Johansson and her son began to drive away from a pharmacy, she noticed a young woman lying on the ground in the parking lot. A small crowd gathered nearby. Moira is a registered nurse and knew something must be wrong. She asked her son to stop the car so she could assist. Moira suspected the woman could be dying from an overdose. As Moira moved closer to check on her, she heard "Don't touch her" from people in the crowd. However, Moira knew she had to respond and sprang into action. The friend of the unconscious woman was on the phone with 911. Moira's trainings and skills kicked in, and she began administering CPR. Moira rendered CPR as the police arrived and then continued to provide chest compressions at the police officer's request until EMS arrived on the scene and took over with the defibrillator. While others stood by, Moira helped save a life. At registration, Cheryl Locke met a patient who had broken both of her knees. The patient cried to Cheryl, expressing that she could not get around easily and was unable to finish unpacking after recently moving into her new home. She had no friends or family close by to help her. Cheryl's conscience led her to take a leap of faith to help this stranger. So they talked further and exchanged phone numbers. Cheryl agreed to meet her at her home to do what she could do to help. Cheryl spent 8 hours unloading boxes, moving furniture around, and organizing items. She returned a second time to help for another 5 hours. At a time of need, Cheryl became this woman's friend and offered a sense of community. Cheryl believes that she was doing God's work and was there for this patient physically, mentally, and emotionally, providing whatever support she needed. The two women have stayed in touch since then, and Cheryl even went to see the finished home after the patient felt better and everything was complete. She did not hesitate to help and be there for someone who had no one. Marie Masters has been a pharmacy technician in Baptist Hospital's inpatient pharmacy for over 10 years. She and her close-knit team lost fellow technician Teresa Crenshaw the day after Thanksgiving in 2021. Teresa was affectionately known in the department as Mother Teresa. Though still grieving, Marie immediately stepped up to support Teresa's family, her 3 daughters, and the grandchild Teresa was raising. Marie gathered resources and offered support during the family's challenging time, while also collecting money to provide Christmas gifts for Teresa's grandchildren. Marie also helped organize a workday to help one of Teresa's daughters meet the volunteer requirements to purchase a home through Habitat for Humanity. Marie keeps in contact with Teresa's family to check on them and let them know that she and the Baptist team are always here for them. Marie keeps a shadow box of Teresa in the pharmacy department. It serves as a reminder of the team's bond with Teresa and the values that she lived. Kathy Saldana, Patient Experience Advisor, took one of the most challenging life experiences imaginable and used it to positively impact others. In January 2023, Kathy was diagnosed with aggressive, invasive, triple-negative breast cancer. She turned to her faith to gain strength, focus, and confidence. Kathy quarantined as much as possible during her treatment and recognized the impact that prolonged isolation had on her. After finally returning to in-person church services, Kathy brainstormed with church leaders to collaborate on an event that would bring people together to uplift others. Kathy returned to her church's worship team and co-organized the first Evening of Art, where musicians, vocalists, actors, poets, dancers, and visual artists came together to glorify God and share their special gifts with the faith community. In addition, Kathy believed that prayer could make a marked difference on our patients' experiences and even their outcomes. So she created the Where to Agree monthly Baptist prayer group, where team members come together online to pray over a standing agenda for our patients, team members, and the organization. During her battle with cancer, Kathy found encouragement and inspiration through the phrase Veni, Vidi, Vici, meaning I came, I saw, I conquered. And she had lapel pins created with that phrase and the breast cancer pink ribbon. She then donated the pins to the Baptist Cancer Institute for other breast cancer warriors. At Baptist, excellence sets us apart. Our legends inspire us to give our best and meet our mission of helping people throughout life's journey. Kim, Moira, Cheryl, Marie, and Kathy live our values of ownership, integrity, compassion, excellence, and service. That is why they are Baptist Healthcare legends.